Hey guys, today we're going to learn about diseases. Now, there are, I think, about 12 different diseases we're going to talk about today. And for each of those diseases, you need to know four things. You need to know how the disease is inherited, you need to know symptoms, treatments, and outlooks for those diseases. Now, when we get to these slides, you will not see it listed as inheritance, symptoms, treatments, and outlook. Instead, there are four bullets. Each of those bullets are in order: the inheritance, the symptoms, the treatments, and the outlook. So the first disease you need to know about is Huntington's disease. This is one that I would recommend you highlight the name of or star it. It is one that you will most likely see on the EOC and you will definitely see on your genetics final. Huntington's disease is the only example of an autosomal dominant disease that you need to know about. There are others, but it's the only one that you need to know about. Now, if you suffer from Huntington's disease, then your symptoms include poor gait and falling a lot. Now, you might be wondering, what is gait? Gait is your ability to stand and walk, and whether you do so fluidly or whether you stagger a lot or might be feeble. So because a person who has Huntington's disease has poor gait, that means that they're not as stable on their feet and therefore fall a lot. Now, another symptom is also drastic mood swings. If you look at the picture on the right half of the screen here, you have a cross-section of two different brains. The brain on the top is a brain suffering from Huntington's disease, and the lower brain is a normal human brain cross-section. You should notice that there are large gaping holes here that are missing in a person who does not suffer from Huntington's disease. You will also notice that the folds in each of the hemispheres of the brain are also quite exaggerated. And that's because Huntington's disease is a neurological disease and it causes a deterioration of the brain. And since your brain is responsible for controlling your bodily functions, including your motor abilities and your personality, it makes sense that drastic mood swings would also be included in some of the symptoms. Now, treatment for Huntington's disease can only be provided for the symptoms as they occur. For example, if you have poor gait and you fall a lot, you might be treated by having a walker or being given a wheelchair, or you might have your cuts and bruises, bandaged as appropriate. If you have mood swings, maybe they'll give you a medicine like Prilosec or something that affects your mood, but you cannot fix the loss of brain tissue. And so ultimately, Huntington's disease will result in death. And usually it's much earlier than the average individual. But the age of death depends upon the number of dominant alleles you inherit. If you inherit Huntington's disease, you will have at least one dominant allele. Okay, but depending on whether you are homozygous or heterozygous, determines when those symptoms arise. If you are homozygous dominant, you will have Huntington's disease and your symptoms will begin showing in your 20s, which means that you will most likely die in your 20s. If you are heterozygous, you will have Huntington's disease because it's a dominant trait and you inherited a dominant allele. You will begin expressing those symptoms in your 30s or your 40s, and you will die within that period as well. If you are 50 years or older and have not been diagnosed with these symptoms, then you would be homozygous recessive and you would not die from Huntington's disease. The next disease is albinism, or being albino. And albinism is an autosomal recessive disease. So because it's autosomal recessive, a person who is homozygous dominant or heterozygous will be normal, meaning they have normal pigmentation, like the girl here in the middle. A person who inherits two recessive alleles will be albino, like the two children on either side of her. And that means that if you're albino, you lack pigmentation of your hair, your skin, and your eyes. And therefore, since you have no pigmentation there, you often need to seek shade, wear sunglasses, and also have a lot of sunscreen, because the pigments in our hair, eyes, and skin help us absorb sunlight and also prevent that radiation from damaging our DNA. Now, if you are albino, you won't die an early death like you would if you had inherited Huntington's disease, but you do need to watch out for increased risk of retinal or skin cancer or another type of cancer correlated with radiation from the sun, because you lack any of that skin pigmentation. The next disease is sickle cell anemia. This one is also autosomal recessive. So much like with albinism, the only way you will inherit this disease is if you inherit two recessive alleles. Now, what happens when you inherit those recessive alleles causes a change in the structure and the shape of your hemoglobin on your red blood cells. And instead of your red blood cell looking like a donut, it actually looks like a donut that has a really big bite taken out of it, or like a crescent moon, or a sickle, if you will. And if you have sickle cell anemia, you will need to seek a lot of rest and frequent blood transfusions, because a sickled red blood cell is not as adequate at delivering oxygen to your cells like a normal red blood cell is. And also, if you exercise a lot, you'll notice that your heart rate increases and your blood is pumping faster. Well, if you have sickled shape red blood cells, they are not as streamlined to go through your bloodstream, and they often can cause clots in your bloodstream, and these sickle attacks, where these little pointy edges are basically pricking you inside of your veins. And those we call sickle cell attacks. So if you get sickle cell anemia, you can live fine as long as you are mindful of your activities and also having frequent blood transfusions. But one of the benefits of having sickle cell is actually that you're able to fight against malaria, a disease that's traveled on mosquitoes, because that parasite requires oxygen. It likes to attack your red blood cells, and since sickled blood cells do not carry as much oxygen, you actually don't really contract malaria if you have sickle cell anemia. The next disease is cystic fibrosis. I believe by now you've heard about cystic fibrosis in a couple different areas, but if not, it is also an autosomal recessive disease. You will have to inherit two recessive alleles in order to be diagnosed with it. And what happens is that thick mucus builds up in your lungs. Normally we have mucus in our lungs. It helps us absorb oxygen and breathe appropriately, but a person with cystic fibrosis has an abundance of it. And that's because they're unable to break it down. And the extra mucus in the lungs leads to increased lung infections and pneumonia and shortness of breath. And it basically feels like your lungs do when you have a serious chest cold. You have really shallow breaths, and it's really difficult for you to breathe, and you probably lack a lot of energy. So we can treat cystic fibrosis with a couple different options. The first, gene therapy, that we talked about in biotechnology, by injecting a person with a normal functioning gene by using a virus. We can also give them breathing treatments like an inhaler and other steroids to help open up their airway. But if you are diagnosed with cystic fibrosis, there is an, on average a shorter lifespan than the normal individual. And the pictures over here show you two different versions of what your lungs look like if you have cystic fibrosis. A normal individual without cystic fibrosis and then one with. You can see that it's very cloudy because the lungs are filled with all that extra mucus. The next disease is Tay-Sachs. Tay-Sachs is, again, autosomal recessive. You can only get it if you inherit two recessive alleles. And if you do inherit Tay-Sachs disease, you will have mental and physiological development for a certain period of time and then a period of regression. So if you are born with Tay-Sachs, you will be able to, you might be able to sit up for a little bit, you might be able to start feeding yourself, but then at a certain period, you will actually regress and go backward. You will lose those skills and those motor functions that you had previously acquired. And it will continue. It doesn't stop. And so it will continue to regress until your brain loses control of being able to regulate your vital organs. And on average, a person who is diagnosed with Tay-Sachs will die around the age of 5. And there's absolutely no way to stop this or treat this. And this is a disease that is most frequent in Jewish populations. The next disease is phenylketonuria, which is abbreviated PKU. Again, it's autosomal recessive. However, a person who inherits PKU lacks the liver enzyme necessary to break down one specific amino acid called phenylalanine. And with a buildup of phenylalanine, this causes your brain to decrease its brain activity and actually look like you have motor and neurological deficits. So the two siblings over here on the right, we have a girl who does not have PKU next to her brother. PKU can be controlled with diet. And normally, if you were born in the US, you were tested for PKU. They prick your little heel and they take a couple blood samples and then they test you for it. And if you test positive for PKU, you will know it, and you will just have a diet that has very little meat or dairy in it, because those foods that are classified as meat and dairy products actually have an abundance of phenylalanine. So if you stay away from those foods, then you will be fine. However, if you have a lot of dairy and meat in your diet and you lose some of that neurological function, you can't get it back. It's permanent. So if diagnosed with PKU, you need to make sure that you control that diet so you don't continue to regress developmentally.